Hi, I will be presenting our project titled Inpatient Candidemia in Ophthalmology Consultation. Candida infections are a significant cause of morbidity and mortality in the U.S. as they are the seventh most common hospital-related infection. Once in the bloodstream, ocular involvement can occur and can lead to vision impairment. Although the rate has been declining, the risk of ocular involvement is not insignificant. After 1990, the incidence of ocular involvement has been about less than 2 to 12% of all cases. In 2016, the Infectious Disease Society of America recommended that all patients with candidemia should have a dilated eye examination, preferably performed by an ophthalmologist within 1 week of diagnosis. However, recent studies questioned this guideline as the average cost is around $5,600 per change in one patient's management. Other studies have shown as few as 3 out of over 7,000 patients have had a potential for improvement. On the other hand, some studies continue to support routine dilated eye examination as part of care in these patients. They emphasize the benefit of risk reduction as a large number of patients may be unable to communicate at the time of diagnosis. Given the varying opinions, it is unsurprising that adherence to the guideline is mixed. Studies have shown about half of these patients had ophthalmology consultations. We performed a retrospective cross-sectional study. We reviewed data from all patients with positive blood cultures for Candida from William Beaumont Hospital, Royal Oak between September 2011 to December 2019. The clinical data was manually extracted. Ocular fungal involvement was defined as dilated fungus examination showing evidence of chorioretinitis or endophthalmitis. There were 380 cases of candidemia identified. However, only 228 cases, or 60%, had ophthalmology consultation completed, with the average wait time between blood culture collection and ophthalmologist examination being 5.54 days with standard deviation of 6.10 days. In some cases, ophthalmologists were already involved prior to positive blood culture. Of the 380 cases, 152 or 40% of cases did not have ophthalmology consultation. The current approach to managing patients with candidemia in Beaumont hospitals usually involved consultation to ophthalmology. We further analyzed the data by separating these cases by years. Fortunately, we found that from 2011 to 2019, more and more patients with candidemia had ophthalmic evaluation. In analyzing our data, we found out of 380 cases, 228 had ophthalmology consultations. Of these, 85 or 31% of encounters were with patients who were nonverbal and/or had altered mental status. Additionally, only 12 or 4% of patients reported vision concerns and 65% had no complaint. On the initial eye exam, only 45 patients had abnormal fundus findings. 7 or 16% of patients had chorioretinitis, 2 or 4% of patients had endophthalmitis, and 36 or 80% of patients had nonspecific fundus lesions. Of 9 cases with ocular fungal infection, only 1 was symptomatic, and the rest were either unable to communicate or had no visual symptoms. Also, 4 of them received intravitreal injection of voriconazole. The most common candidal species identified were C. albicans, C. glabrata, and C. parapsilosis. The most used antifungal medications to treat the candidemia were micafungin and fluconazole, used in 246 and 171 cases respectively. Among the 380 cases, 59 patients received at least one of the antifungal medications during their hospitalization. 26% received 2 different medications, though this might have not been administered simultaneously, and 1% took 3 different medications. 55 out of the 380, or 14.5% of patients, did not receive any antifungal medication. Our study found a low incidence of fungal eye infection in patients with candidemia at Beaumont Hospital in Royal Oak, Michigan. though a significant portion of cases ophthalmology was not consulted for. However, in recent years, a greater percentage of candidemia cases involved ophthalmology consultation. In most cases, dilated eye exam was performed by an ophthalmologist within 7 days. A majority of patients with ocular involvement denied visual impairment or were nonverbal at the time of diagnosis, as many of them required more intense antifungal management such as intravitreal injection and closer ophthalmic follow-up. The role of ophthalmologists remains important in caring for patients with candidemia, and they should be involved in caring for these patients.